feel a sharp or nagging pain in the front or side of your shoulder when you pitch? I'm Dr. Jeff Lewis, owner of Lewis Physical Therapy and Sports Rehab, where I help baseball players get stronger and back to throwing pain-free. Today, we're diving into subacromial impingement, what it is, how it shows up in baseball pitchers, and most importantly, how we treat it to get you back on the mound stronger than ever. Let's start with what's actually going on inside the shoulder. Subacromial space is a small area between the top of your humerus, which is your upper arm bone, and a bony structure above it called the acromion, which is part of your shoulder blade. Inside that space lives your supraspinatus tendon, which is part of your rotator cuff, a bursa to decrease friction, and the long head of the biceps tendon. When that space gets narrowed due to poor scapular mechanics, inflammation, or muscular imbalances, it causes these structures to get pinched or irritated, especially with throwing. Now, let's talk about how this shows up in pitchers specifically. You might notice pain in the front or side of the shoulder during late cocking or acceleration, loss of velocity or command, pain with lifting overhead or getting into end range external rotation, a sensation of pinching or catching, difficulty sleeping on that shoulder, and maybe some other symptoms that are specific to each person. Often, these symptoms start gradually. Maybe it's just soreness at first after an outing, and then they progress to the point where even light throwing can cause pain. A major contributor in pitchers is scapular dyskinesis, or poor control of the shoulder blade, which alters the mechanics of the shoulder joint and can lead to further narrowing of that subacromial space during throwing. Subacromial impingement usually isn't just one issue. It's the result of several movement problems coming together. The big ones are weakness or lack of coordination of the rotator cuff musculature, poor scapular upward rotation or posterior tilting due to a weak lower trap and serratus anterior, limited thoracic mobility, especially towards the arm side, and then overuse and lack of in-season strength training, and sometimes even tightness in the lats or pecs to pull the shoulder into not great positions. In pitchers, especially high school or collegiate athletes who throw year-round without proper in-season strength work, this can build up quickly for them. Now, the good news. This is treatable without injections or surgery in many cases, especially when caught early. And typically, pitchers are able to begin throwing relatively quickly, sometimes as early as 7 to 10 days after being initially shut down. Here's how we typically approach it. Phase 1, calm it down and restore mobility. We temporarily shut down from throwing and modify gym work. The primary focus here is on decreasing inflammation, restoring pain-free motion, and beginning light rotator cuff and scapular isometric strengthening. Phase 2, scapular control and cuff loading. This is critical. During this phase, we will start to focus on progressing strength work throughout the rotator cuff and scapular muscles, especially the serratus anterior and lower trapezius, to establish proper shoulder mechanics. This might include dumbbell side-lying external rotation, prone Y lower trap drills, and serratus wall slides. Phase 3, progressive strengthening and plyometrics. We begin to reintegrate back into the gym through push-pull movements, while also building resilience back with eccentric cuff and scapular work, ballistic shoulder drills, and medicine ball work to prepare for the return to throwing. Phase 4 is the return to throwing progression. Once pain-free and clear on strength and range of motion testing, we reintroduce throwing through a structured program tailored specifically to your level, not just long tossing and hoping for the best. So if you're a baseball player dealing with that nagging front shoulder pain you suspect impingement, don't wait. This rarely goes away on its own and can spiral into rotator cuff or labrum issues down the road. If you want to get stronger, faster, and throw harder this season, check out our 10-week triple threat system designed specifically for high school baseball players to take their performance to the next level. And if you're unable to throw without arm pain, text arm pain to the number below to request your free copy of the Arm Pain Blueprint and learn how our proven method can get pitchers stronger and back to throwing pain-free. If you found this helpful, like, subscribe, and drop a comment with what part of your arm care needs the most work.